Hi, everyone. I'm Dr. Swanson alongside Dr. Shaw from KSB Foot and Ankle, and we'd like to welcome you to tonight's KSB Community Wellness presentation. I'd like to thank Aaron Fox as well for putting this on this evening. We would like to discuss with you tonight Achilles tendon injuries and treatment, and hopefully we can share some information that can be helpful for you. So topics we will discuss include anatomy, causes of injury, different types, signs and symptoms, treatment, and finally, prevention and risk reduction. So first, a little bit about the anatomy of the Achilles tendon. The tendon is the largest and strongest in the human body, and it connects the calf muscle to the heel bone. It's comprised of tough, flexible tissue that allows the foot to point and flex. The function is we use this tendon mostly for walking, running, and jumping. It acts as a powerful spring to help propel the body forward during activities, and forces can actually exceed 6 to 8 times our body weight, especially when running. What's the importance of understanding the anatomy? Well, it is crucial for identifying points of injury, and then that helps us to determine the appropriate treatment options for our patients. So causes of injury. The first one, overuse. This involves repetitive stress on the Achilles tendon from activities like walking, running, jumping, or intense physical exercise. Leads to overuse and inflammation around the tendon. Even footwear can be a cause. Wearing inappropriate or worn out footwear can cause injury. It does not provide the adequate support and cushioning that's needed, and this leads to strain. Then also biomechanical issues. So abnormal foot structure, potentially a low arch foot or a high arch foot. Maybe there's a lower limb length discrepancy or leg difference, and muscle tightness as well. These can all affect the function of the Achilles tendon, which increases the risk of injury. So types of injuries. This first one is one that we see very commonly. Tendinitis refers to inflammation of the tendon due to overuse, and this can lead to pain, swelling, stiffness. It is very common among athletes and individuals that engage in repetitive activities. Sometimes patients will say after they sit or lay down, once they go to get up again, they feel pain in the back of their heel, and this can tell us that they are experiencing tendinitis. The second is a rupture. A rupture can involve a partial or complete tear or rupture of the Achilles tendon, and this often results from a sudden forceful movement. This injury can be very painful and hinder mobility, so the foot is not able to point and flex or propel the patient when they're walking forward. A lot of times patients will say they hear a loud pop as well with a complete rupture. Tendinosis refers to chronic degenerative condition of the tendon, and it's characterized by micro tears. And over time, these micro tears, the body can sense that, and it tries to repair itself by thickening the tendon, but this also can weaken the tendon and the tissue over time. It usually develops over time and can lead to persistent pain as well. So now I'd like to turn it over to Dr. Shah, and he'll begin with signs and symptoms.
Thank you, Dr. Swanson. So some of the signs and symptoms for when we have Achilles tendon rupture specifically, as you can see on the image, is you have a lot of bruising on the back of your heel, and there's swelling associated with it due to the injury itself. And then as you are feeling the tendon on the back of your heel, as you are going down, you'll see what we call a dell, or meaning a space between the area where there is a rupture site at the tendon site. And as you can see from the right foot versus the left foot is the foot that has the Achilles tendon rupture, and they're not able to really have flexion of that ankle. So that's one of the things that we look for in clinic by squeezing the calf and seeing if they're able to kind of flex the ankle down. So some of the treatments can be come from conservative all the way to surgical as well. So some of the conservative treatments include resting, icing, physical therapy, and orthotic devices for mild Achilles tendon injuries or tendinitis to reduce that inflammation, help with pain, and promote healing. In severe cases, when we have a rupture that is greater than 3 or 6 centimeters in length, or if it's chronic, meaning that it ruptured but they never really got treatment and they continues to have pain, is when we recommend surgical treatments. And usually there are various types of surgical treatments out there where newer trends are doing it percutaneously, or actually opening it up and readdressing the tendon. There are newer therapies out there as well, including platelet-rich plasma injections, and that has shown some research in accelerating tendon healing and improving outcomes for certain Achilles tendon injuries. The big thing with Achilles tendon injuries itself is the importance of rehab. So a comprehensive rehab program is aimed at strengthening the Achilles tendon, and that helps improve flexibility and restoring the function to regain mobility and preventing re-injury. The expected recovery from these type of injuries, again, depends on the type of injury and the severity of the injury. Usually involves progressive weight-bearing activities, gait training, and exercises to rebuild muscle strength and endurance. Return to activity, usually patients often go through extraneous physical therapy. Individuals should follow a gradual and structured plan to ensure that the Achilles tendon has fully healed and adapted to the demands of the movement. So you don't want to go from not moving at all to going to go play soccer, for example. So you want to do a gradual return to activity. Some of the preventions and risk reduction, proper footwear. So choosing supportive, well-fitted footwear and using appropriate sports equipment can help minimize stress on that Achilles tendon and reduce the risk of injury during physical activities. Gradual progression is another one. So engaging in more of a progressive training regimen, including warm-up and cool-down routines, can prevent abrupt stress on the Achilles tendon and promote gradual adaptation on the exercise intensity. And strengthening, incorporating diverse physical activities such as strength training and flexibility exercises can all enhance pretty much overall fitness and reduce the likelihood of overloading the Achilles tendon to repetitive motion. So at this point, I would like to hand it back to Dr. Swanson.
Thanks, Dr. Shaw. Well, good. Well, that concludes our presentation for this evening. If you feel that you are experiencing any tendon pain regarding your Achilles, we are more than happy to take a look. Please feel free to reach out to make an appointment. Also, if there are any questions, feel free to leave them below and we'll be happy to get back to you as well. Once again, I'd like to thank KSB Community Wellness and Aaron Fox for putting this event on this evening. And we hope everyone has a great and safe start to their spring. Thank you.